Hello, my name is Debbie and I'm a practice nurse in London. Today I'm going to be discussing the pros and cons in practice nursing. Now, just a disclaimer, my pros and my cons are personal to me, but there may be something that you may find to be fine. So let's get into it. So how I'm going to do it is I'm going to say a pro and I'm going to counteract it with the con of that pro, if that makes sense. So number one, Monday to Friday. As a practice nurse, you very rarely work weekends in your contract, and it is Monday to Friday or Monday to Thursday, or one day a week you have off, or you have a half day, etc. So there is no shift work, there are no night shifts, and bank holidays you have off. Now for me, this is a big pro. However, for some people this may be a con, because with no shift work means working Monday to Friday means you rarely have time off in the week and you can't do extra shifts. Whereas in the ward, if you work 3-4 days a week, you can top it up with extra shifts, and that can obviously help boost your finances. But for me, that's not a problem. I enjoy working Monday to Friday and having my weekends and bank holidays off. Number two, pay. Now, GP practices are privately funded, and of course they see NHS patients as well as being under the NHS, but they do not follow the Agenda for Change pay scale, nor do they follow the banding system that the hospital follows. So this means that your pay can be negotiated. So you can basically, according to the skills that you have, negotiate your pay. Now, this can be a big pro and it can also be a big con. Because practices are funded according to the patients that they see, the targets that they meet, etc. If a practice does not have the funds that you would like to be paid, or the salary that you like to be paid, you'd obviously want to move practices. However, it can serve as a pro because you're not at a set salary. After a few months, after you've done a few changes, you can go to your manager again and be like, okay, I've done this, you've done a few trainings, I've done this, I've done that, and so I would like my salary to increase. So I think that is a big pro, but it can serve as a con because I personally think, especially with nursing, I don't think that we're really taught, unless it's within you, it's by nature how to negotiate your salary. I don't think within our course and the way it is, we're really taught on how to negotiate our salary. Number three would be a pro, I would say, is the continuity of care. So you're able to see the same patients over and over again. You pretty much, there's some children that you would see when they are 8 weeks old for their first immunizations, and then you get to see them at 1 and then 3, and then I get patients that come in and they're like, oh, the other nurse, because my other nurse here has been here like 17 years, and it's like she saw me when I was a child, and now they're in their 20s, and it's like they still know her. So I think that's amazing. For me, the con of this sometimes with continuity of care is that sometimes it can be repetitive in terms of, so there are patients that I do their dressings for them over and over again because maybe they've got a non-healing ulcer, or usually that's the main type of dressing. So it's just like every week or every other twice a week, seeing the same wound over and over again, which can be a bit tedious, to be honest. But other than that, I think continuity of care is amazing. Now, number 4, I would say is, for me, is a big pro, and that is that in a GP practice, you're in a smaller team. So in my practice, there are only 2 nurses, me and another lady, and we've got 1 healthcare assistant. That is the nursing team. We have a few doctors, 1 in-house pharmacist, 1 social worker, and the rest are just admin team. We have physio as well. However, you're in your room, you're seeing your patients. It's not as busy and hustle and bustle as the hospital would be, what I would say. Now this can serve as a big con as well, because in the hospital, what I find is if you need help, you can, you know, just pull someone and just ask someone if you need help. But in the GP practice, you have your list, everybody has their list, everybody has their patients, and so everybody's busy and everyone's got something to do. Which can make it quite hard to ask for help sometimes. But I do love having a small and intimate team personally. And number 5, I would say, is a big one for me, and that is being able to see well patients who are well. They've just come in maybe for a blood test. They might have a few hiccups here and there, you know, I've got a cough, I've got a cold, all these things, but they are not critically ill. And for me, I like that. It's good for my mental health. And yeah, I enjoy seeing that. As a con, which I wouldn't really say is a con, but there are certain skills that you keep going, or you know, because you've worked in a critical setting. So for example, being able to do an IV, you know, quickly, or being able to really notice a deteriorating patient very quickly. Patients very rarely deteriorate right before my eyes in clinic, so therefore that's a skill that I'm always trying to keep on top of, simply because I don't see it every day. So that can also be a con. Number 6, I would say, is being an autonomous practitioner. This is big for me. Like, I enjoy the fact that I can speak to my patients and tell them, you know, this is what you need to do, and what I say, and how we negotiate together and make that shared decision making. Being able to do that with my patient one-on-one, I really love and enjoy that. Now this can prove as a con, especially when you're newly qualified, because you're at the beginning, you're quite doubtful of your clinical reasoning, your clinical decisions, and you're always having to ask for help. And then it goes back to being in a small team, because when you're in a smaller team, there's less people to ask help from. So this can be a little bit of a con, because you know, what you say to that patient there and then is what they're going to take on board. But once you've brushed up on your skills and you're getting a lot better, you've become very confident in yourself and your clinical skills. So lastly, number 7, which I would say is a pro, and I don't think it has a con, is the opportunity to specialize. Now within a GP setting, I think it's easier to specialize without having to apply for a whole new role. So within a practice, they may need a diabetes specialist, for example. I use diabetes because that's something that I'm passionate about. And once they know that that is your interest, there's clearly a need in almost every practice for a diabetes nurse specialist, or an asthma nurse specialist, or a sexual health nurse, for example. So as long as you're willing to study, you can stay within that same practice, study, and then become the lead nurse or the specialist nurse in your practice. Whereas, for example, in the ward, to become a specialist, you have to apply for a whole new role, join a whole new department if you start off in the ward. So if you're in a respiratory ward, you can be working on that ward, and once you want to become a respiratory nurse specialist, you would need to apply for that whole role, which you don't have to do in a GP setting, which I find great. So I hope that's helpful. Just like in any job, there are pros and cons everywhere you go. Nowhere is perfect. Just find what works for you and negotiate for what will work for you, and hopefully you're gonna find your dream job.